Brought to you by the medical professionals at Carpal Pain Solutions, developers of the Carpal Rx.
Carpal tunnel syndrome is a painful and often debilitating disease that begins in the wrist joint. It most commonly has symptoms like pain, numbness, tingling, and soreness in the fingers, hand, and the wrist. With patients becoming increasingly dissatisfied with carpal tunnel surgery, they seek non-surgical treatment options. One of those non-surgical treatment options is chiropractic medicine, and at a cost of $40 to $65 per treatment, it's natural to ask, is it effective for carpal tunnel syndrome? Chiropractic medicine can be effective in alleviating carpal tunnel syndrome, but only if it includes deep tissue massage of the wrist and forearm, and only if that massage is performed daily and for a period of 2 to 4 weeks. Chiropractic deep tissue massage is effective because it drains fluid inside the carpal tunnel and breaks the adhesions that cause inflammation. To understand why this is important, we have to understand carpal tunnel syndrome. Carpal tunnel syndrome is actually a disease that begins deep inside the wrist joint, inside a confined area known as the carpal tunnel. Inside the carpal tunnel, your flexor tendons, here shown in white, are very close to the median nerve, here shown in yellow. The tendons are surrounded by a fluid-filled sheath, here shown in blue. Under certain conditions, like rapid hand movement, that sheath begins to swell and it pushes against the median nerve. And that causes all of the symptoms of carpal tunnel syndrome. So if you have the symptoms of carpal tunnel syndrome like pain, numbness, tingling, soreness, or burning in your hand and fingers, it's natural to ask what you can do to relieve them. If you're thinking of having surgery for your carpal tunnel syndrome, discuss with your doctor the fact that most people are dissatisfied with their surgical results. But the overwhelming majority of people who treat with non-surgical therapy are quite satisfied with their results. Your doctor should candidly and openly inform you of this because those statistics are so important that the Association of Orthopedic Surgeons and the National Institutes of Health recommend that all patients try all non-surgical options before considering surgery. Those non-surgical therapy options are rest, night splinting, and deep tissue massage. These simple methods are very effective in relieving symptoms. In fact, deep tissue massage is nearly 100% effective, but only when applied daily and for 2 to 4 weeks. Otherwise, it won't alleviate symptoms. Thanks to a new technology, you don't have to see a therapist every day to get this treatment. This technology is the amazing Carpal Rx. It's like a take-home therapist, where you put it on your forearm twice a day for 15 minutes. It's carefully calibrated to produce the same motions, speed, and pressures that a therapist uses when performing deep tissue massage on your wrist and forearm. And it's so simple to use. Just plug it in, slide it on, strap it in, and relax. The Carpal Rx will do all the complex deep tissue massage for you. So don't waste your money on going to a chiropractor or a physical therapist every day for deep tissue massage treatment. And throw away all those splints and braces that just don't work. And don't even think about having surgery. If you have carpal tunnel syndrome, wrist tendonitis, or repetitive strain injury, you owe it to yourself to try this remarkable product. The Carpal Rx always comes with a 60-day free trial, so if you're not completely satisfied, return it for a complete refund of all of your money, including your shipping costs. The Carpal Rx is guaranteed to get rid of all of your symptoms, and it will do it easily, completely, comfortably, and cost-effectively. Remember, it's completely guaranteed to work for you. Learn more at carpalrx.com.